occurs sometimes when you don't expect it at all. It's often very fleeting, and it's not very well meshed with communicative bids and attempts to engage someone in an interaction. Our children often experience a range of emotion during one evaluation. They can be very happy, they can be frustrated, they can be even angry. However, what is striking, and this is a very powerful way of communicating emotional states to others, a very powerful way to communicate emotional states to others is to simply look at someone and make the face, right? You immediately communicate to mom that there's something not quite right and you need help. Our children experience all these emotions, but they very rarely direct them to other people. They do not communicate how they feel, and which makes their life, which makes the world even more so isolated. As I mentioned, children with autism at this age also have difficulties sharing the experiences with others, engaging in joint attention, and also they usually do not monitor behaviors of others to the extent necessary or seen in typically developing children, and they have difficulties learning via imitation. In terms of communication, it's a very interesting area as far as toddlers are concerned. The reason is that most of the children we see in our clinic at this age are primarily nonverbal. However, in order to assess their quality of communication, we still can focus on the nonverbal communication and various aspects of communication having to do with why they communicate, what kind of means they use, and how well they are integrated with social behaviors. For instance, our toddlers communicate very infrequently. A typical toddler communicates about 3 times per minute. A child with autism might communicate 3 times per half an hour. Now, children who do have language delays, and most of our children do have language delays, are capable of compensating for lack of language with use of communicative gestures, expressive facial expressions, and also eye contact. What we see is in autism we see lack of these non-communicative behaviors, lack of gestures, and inconsistent use of eye contact for communicative purposes. Now, some of our children actually do communicate occasionally, but primarily to get their needs met. There are 2 reasons why we communicate with other people. One is for instrumental purposes, to make them do what we want them to do. And the second, we communicate in order to share our experiences. We call it declarative purposes versus instrumental purposes. Children with autism can be very, very effective in communicating their needs. But what we see is this disparity in frequency of communication for instrumental versus declarative purposes. Now, for those where we see language emerging, we also unfortunately see that atypical features of language are becoming apparent. So a child might repeat verbatim what they just heard. If you ask them, do you want juice? Instead of saying yes, no, or nodding their head, they can repeat, do you want juice? With exact inflection, exact intonation. We call it echolalia. Also, there's another very interesting feature which we see in some, not all children with autism, but when we see it, it's quite specific to autism. We call this feature hand-over-hand gesture. If you ever come to our clinic and you have an opportunity to observe one of our toddlers, you might be able to see it. It's quite striking when it happens. It is a situation in which the child tries to communicate what they want, let's say they have a container which is tightly closed, they cannot open the lid, and instead of giving it to an adult with some kind of indication that they want it open, they might look around them, they grab the first hand they see, they pull the hand, they put the hand on the container as if they were using this hand as a tool, disembodied from the rest of the person. It has a very interesting feel when you are a subject of this kind of manipulation. And it's quite, as I said, we see it in some children, not all children with autism, but when we see it, it's a quite diagnostic sign. Children with autism also have deficits in play. Play early in development is very important for development of language and cognition. Our children tend to use objects in a typical way. When they explore objects, they often focus on physical characteristics, how the object feels, how the object smells, what kind of noise it can produce, or they focus on the details of the object. This is a picture of a little boy who likes to line up his toys, and that might be one of the primary modes of his play. Now, in young children, we see some of the repetitive behaviors and unusual sensory interests as well. Some children might be overly sensitive to touch, or might be very interested in certain types of motions. So we've had children, toddlers, who can spin pretty much